The text reference for this section is Chapter 15. There are many ways to fabricate interim restorations. A direct technique using the vacuum-formed matrix and auto-curing acrylic will be employed. For this exercise you will need plastic vacuum-formed matrix, adequately prepared abutment tooth, auto-curing resin and monomer, lubricant, small cup of water or water spray, disposable cup and mixing spatula. Ensure that the matrix fits the dentiform model and that adequate tooth reduction has been performed. Lubricate the area of interest on the dentiform. Mix auto-curing acrylic with liquid monomer in a disposable cup. Dampen dish with a mixing spatula. Various shades of acrylic may be blended to achieve the desired aesthetic effect. Place cotton on either end of the plastic matrix to retain the acrylic, if needed. Avoid using too thin of a mixture, but the material should still flow. Fill the appropriate area in the matrix with acrylic. Allow the acrylic to set until the sheen is gone. When the sheen is gone from the acrylic, remove the cotton and seat the matrix carefully on the dentiform. Allow the acrylic to set for 30 seconds. Gently lift the matrix 2 to 3 mm and reseat. Repeat this procedure every 15 to 30 seconds. When the acrylic becomes warm, cool with water spray. Perform this several times until the heat dissipates. When the acrylic remaining in the mixing cup is cured, cold to touch, remove the matrix and remove the temporary from the matrix. It may be helpful to mark the margins of the temporary with a sharp pencil. Trim gross excess acrylic with an acrylic burr, finer adjustments with a variety of discs. A list of instruments for finishing is suggested. The restoration should be gently pumiced with wet flour pumice and a wet rag wheel. Apply light pressure and use the slower speed for the wheel. Clean thoroughly. Evaluate the finished restoration for marginal integrity. Proximal contacts should be at the appropriate location, of correct width, and provide resistance to flossing. Occlusion. The patient's occlusion is the same with and without the restoration in place. There are no unwanted lateral interferences. Contour. The restoration should mirror the contralateral side. Color. The color should be acceptable to the patient and operator. Disadvantages of this method. It is a direct method, thus uses chair time. Can burn the patient. Heat. Chemical. Can and will get stuck. Not universally applicable. Laboratory safety. Acrylic is best used with air evacuation. Use the desktop suction and eye protection when curing and grinding acrylic. Rinse uncured monomer from hands. Avoid getting hair in lathe. Careful with the use of discs, as they can easily injure fingers.